Have you ever noticed a small change, a tiredness that lingers, a memory that trips you up, a few pounds that vanish without meaning, and simply told yourself, that's just aging? You're not alone. Most of us do that. We smooth over the whispering signs and keep going. But sometimes those whispers are the first sentences of a much larger story. Today we'll sit with 5 subtle symptoms doctors say you should not ignore after 65. I'll share clear examples, short human stories, and gentle advice about what you can do next. This is meant to empower, not alarm, because the earlier we catch things, the more options we have. Unexplained fatigue, when just tired, isn't normal. Fatigue is common, but there's a difference between I'm a little slow today and a persistent exhaustion that doesn't lift after rest. Mary's story. Mary, 73, loved her morning routine, a walk with her small terrier, a cup of tea on the porch. Over several months, she found she couldn't keep up. She would sit for 10 minutes to rest after a short walk. At first, she blamed the heat, the dog's slow pace, just getting old. Her daughter finally persuaded her to visit the doctor. Simple blood tests showed Mary had iron deficiency anemia caused by a small, treatable stomach ulcer. Once treated, her energy slowly returned. What this symptom can mean? Persistent fatigue can come from many causes: low iron or vitamin levels, thyroid changes, heart or lung problems, undiagnosed diabetes, medication side effects, or even early cancer. It can also be a sign of depression or sleep disorders. How to notice it? Ask yourself, is this new? Is it getting worse? Does rest or a good night's sleep help? Are there other symptoms with it, like shortness of breath, dizziness, or a change in appetite? What to do? Keep a short diary for 2 weeks. Note when you feel most tired, how long you sleep, any new medicines, and if simple activities feel harder. Bring this diary to your primary care doctor. Common first checks include blood tests, a review of medications, and sometimes a simple heart or lung exam. When to seek help urgently. If fatigue comes with chest pain, fainting, severe shortness of breath, or sudden confusion, seek immediate medical care. Unintentional weight loss, the quiet red flag. Losing a few pounds might sound like a blessing, but after 65, significant weight loss without trying is often a signal that something isn't right. George's story. George, 69, noticed his clothes felt loose. He hadn't changed his diet and still enjoyed his morning toast and coffee. Over 2 months, he lost nearly 12 pounds. He felt guilty for not paying attention. At the clinic, he learned his weight loss was due to a problem with his digestive enzymes. Further tests revealed a treatable pancreatic issue that had been affecting his nutrient absorption. What this symptom can mean? Unintentional weight loss can point to digestive problems, difficulty absorbing nutrients, chronic infections, thyroid problems, depression, or cancers. It may also reflect dental or swallowing problems that make eating uncomfortable. How to notice it? Watch the scale or how your clothes fit. If you lose more than a few pounds in a month or have noticeable loss over a few months without trying, write it down. Pay attention to appetite changes, chewing or swallowing difficulties, or new digestive symptoms like nausea or changes in bowel habits. What to do? Make a list of medications, appetite changes, dental problems, and any recent stressors, loss of a loved one, new living situation. Bring measurements or records if you have them. Your doctor may check weight history, run basic blood tests, look at stool tests, or recommend imaging if needed. Practical tip. Keep a simple weekly weight log. Many pharmacies have scales, or use a home scale, and bring this when you visit the doctor. Even small numbers matter when they add up. Memory and mood changes when forgetfulness feels different. We all misplace keys or forget a name. That's normal. But when memory lapses become more frequent, or when personality and mood change subtly, that's a different story. Eleanor's story. Eleanor, 75, used to teach art classes. Lately, she'd repeat a story within minutes and began to lose interest in her studio time. Her family assumed she was tired after a busy retirement trip, but when she got lost on the familiar drive home, they sat down and talked. Her doctor ran simple memory tests and blood work. Eleanor was diagnosed with mild cognitive impairment. Part of it came from low vitamin B12 and part from early changes in thinking. Because it was caught early, she started a plan of cognitive exercises, nutritional therapy, and closer monitoring, which helped her maintain independence longer than expected. What this symptom can mean. Memory changes may be caused by vitamin deficiencies, thyroid problems, medication side effects, depression, sleep apnea, or early stages of dementia. Mood and personality shifts can be early, subtle signs of neurological changes or emotional health struggles. How to notice it. Look for patterns, repeated questions within minutes, trouble managing simple bills, getting lost in familiar places, or withdrawing from hobbies and friends. Also notice mood, increased irritability, apathy, or anxiety that is new or out of character. What to do. Start a gentle, loving conversation with the person involved. Record examples. What happened, when, and how often. Share this with your primary care physician. Early evaluations are usually simple. A memory screen, review of medications, and blood tests to rule out treatable causes. Supportive steps. Keep a calendar, use large print notes, set phone alarms, and maintain social routines. Mental stimulation, puzzles, reading, gentle classes, and social time helps. If mood changes are prominent, check for depression or sleep problems, both of which are treatable. When it's urgent, sudden severe confusion, hallucinations, or a rapid change in personality should be evaluated right away. Changes in balance or gait, the early predictor of falls. A slight shuffle, a stumble on the curb, or needing extra support on stairs might seem small, but balance changes are one of the strongest predictors of future falls. And falls can change someone's life overnight. Frank's story. Frank, 70, noticed his feet seemed to catch on the carpet more. He told his golf buddies, who laughed and called it a new rhythm. But Frank started avoiding stairs and held the railing longer. At his checkup, his doctor tested his walk and found a subtle change in his step and muscle strength. Physical therapy and a home safety check reduces risk, and he learned exercises that improved his steadiness. What this symptom can mean, balance changes can come from inner ear problems, decreased leg strength, vision changes, medication side effects, neurological conditions like Parkinson's, or even low blood pressure when standing up. Many are treatable or improvable. How to notice it. Pay attention to new unsteadiness, slower walking, more help needed to stand up, unexplained bruises, or leaning to one side. Ask whether stairs, stepping onto curbs, or turning around feel harder than before. What to do. Have your gait and balance checked. Simple measures often help. A review of current medications. Some cause dizziness, strength and balance exercises, vision and hearing checks, and removing trip hazards at home. A targeted physical therapy program, often short and focused, can make a big difference. Practical, immediate tips. Wear supportive shoes with good soles. Remove loose rugs, add night lights, and consider a low-cost, non-slip mat in the bathroom. Small changes in the home can prevent big falls. Shortness of breath and reduced stamina when everyday tasks become heavy. If climbing a short flight of stairs or walking across the grocery aisle leaves you breathless in a way that's new or worse than before, take note. Breath tells a story about your heart, lungs, blood, and overall fitness. Linda's story. Linda, 74, clutched the mailbox and rested halfway up her driveway. She blamed the humidity and moved slower. But over months, the breathlessness became noticeable even at rest, and her ankles were slightly swollen at the end of the day. Her doctor checked her heart and lungs and found early heart failure, not as a frightening immediate crisis, but as a condition that benefits hugely from early treatment and lifestyle adjustments. With medication changes, fluid management, and gentle cardiac rehabilitation, Linda regained comfort and confidence. What this symptom can mean, shortness of breath can be caused by heart conditions, lung disease, anemia, infections, or even deconditioning. It can also appear with anxiety, but it's safest to have it checked. How to notice it. Is breathlessness new, or does it come with chest pressure, swelling in legs, or a cough? Does it worsen when lying flat, or wake you at night? These details help the clinician identify likely causes. What to do. Describe when it happens, how long it lasts, and what you were doing. Bring a list of medications and any recent tests. Your doctor may check oxygen levels with a simple clip-on device, do blood tests, listen to your lungs and heart, and may order an X-ray or ECG if indicated. When to seek emergency care. Sudden, severe shortness of breath, Chest pain, fainting, or coughing up blood are emergency signs. Call emergency services right away. Aging is not a one-way slide. It's a next chapter that benefits enormously from attention and small actions. These 5 subtle signals, persistent fatigue, unexplained weight loss, memory and mood changes, balance shifts, and new breathlessness, are not meant to frighten you. They are invitations to listen more closely to your body and to the people who love you. To make this practical, here's a simple checklist you can use today. Keep a short symptom notebook for 2 weeks. Record tiredness, weight, memory lapses, falls or near falls, and breathlessness. List all medications, including vitamins and over-the-counter remedies. Some common drugs increase risk of dizziness, fatigue, or memory problems. Ask a trusted family member or friend for observations. Sometimes others notice changes before we do. Bring your notes to your primary care doctor and say plainly, "I've noticed these subtle changes and I'd like to check them out." That sentence opens the door to tests and to early treatment. Make small home adjustments today. Remove tripping hazards, add brighter lights, wear supportive shoes, and make mealtime social to encourage appetite. Before we go, I want to ask you something. Has one of these small changes ever happened to you or someone you love? What did you do and what did you learn? Share one short line in the comments. Your experience could help someone else know they're not alone. If this video helped you understand what to watch for and what steps to take, please like and share with a friend or family member. Subscribe for more gentle, practical guidance on health after 65, because hearing these quiet signals early can change everything. Thank you for listening carefully to your body today. Small whispers saved can become big second chances tomorrow.